Speaking of things that have gotten out of control, probably not as quickly though, the health issue continues to plague the entire country and is on the front page of The Australian tomorrow. States want an extra $5 billion for health. States will call on the federal government to inject an extra $5 billion into public hospitals every year when Anthony Albanese convenes his first National Cabinet meeting on Friday. They'll also use the meeting to push the new Prime Minister for an extension of COVID-related healthcare expenses beyond September. Sarah, National Cabinet, it's still a thing. It kind of fell apart towards the end of the Morrison administration, but it seems like we're back. I think when everyone on the majority of that Cabinet will be Team Red, it could be a pretty easy breezy cover girl type situation, but maybe not, considering health is such a major bugbear for most of the premiers around the country.
Yeah, you've said it. I mean, Albanese made very clear during the election that he was going to, work with premiers. He wasn't necessarily drawn on that's specifically National Cabinet. Are we going back to COAG? I think some of those mechanisms are still going to be sorted out as the weeks go on. Particularly, as you've said, though, the main thing that's going to be at the front and centre is health funding. We've heard this a lot over the last few years, as we should, during a pandemic, in terms of the need for more health funding. And in terms of also, during the election, I think there was this sense of, particularly from Morrison, that COVID's behind us a bit, let's not look at that, we're moving forwards. But the fact is the rates in Australia are actually really high compared to international standards, and hospitals are still buckling. I know other front pages today are looking at health systems that just can't actually manage the sorts of demands that we're seeing. So, I mean, it makes sense the state governments and territory governments are really concerned about being able to keep up with what's not a sort of done deal with COVID. It's still here. We're now facing a really big flu season because obviously lockdowns are all over. We are all coming out of that time. So for health to be front and centre, and for always the share of health funding and how much the states put in compared to how much to the feds and who's doing the heavy lifting and etc., that's always going to be a thing regardless of who's in power federally. But it will mean a pretty challenging, I think, conversation. I mean, a lot of them are all the same colour on Friday, but this is definitely a bugbear, as you say.
Yeah. Ollie, the interesting thing is that a lot of people could, or specifically the Prime Minister, could just say, look, health is a state issue. And you look at WA alone, they're sitting, they've got more money than God at this point in time. And we've got people dying in the back of ambulances ramped outside of hospitals. I can only see this going one way, of the states that maybe don't have the generous share of the GST, maybe starting to bang their fists a little bit to say, well, McGowan, you're not doing anything with it, so let's share the love around.
Yeah, and they will. And that argument's already starting. You hear from the South Australian government, you hear from the Victorian government. Sure, they might all be, Team Red like Dove soap, but at the moment, you start then being able to, wrestle the arms of your colleagues, because Anthony Albanese could have a tough conversation with Mark McGowan because they're both on the same team. Well, you do this for me, I'll scratch your back there. I would be a very, very brave Prime Minister, though, to try and wedge Western Australia's GST share. As we all know, that is the one biggest issue over this side of the Nullarbor at the moment, which really gets West Australians particularly fired up. But I think that we have to throw the kitchen sink at healthcare. What I find also fascinating, Jenny, you've got Dominic Perrottet promising 10,000 nurses, Daniel Andrews 5,000 nurses, Anthony Albanese a nurse or extra nurses in every single aged care home. Mark McGowan's made a similar pledge. Nurses don't grow on trees.
Yeah.
So there are so many issues within health at the moment, but right now I think resourcing it properly, making sure, as you say, people don't die in the back of ambulances, they get to hospitals on time, and we have enough people working in the system has to be number one priority. Throw the kitchen sink at it, whatever it takes. This is the country we live in, and let's make it happen.